Welcome to NCPDP Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators, discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
All right. Well, Sean, welcome to the NCPDP Unscripted podcast. Excited to have you on today.
Thank you so much, Pooja. It's my pleasure.
Great. So now this is your very first NCPDP work group meeting, correct?
It is. Yeah.
Okay, great. So tell us a little bit about yourself, your background, and then we'll dive into the conversation.
Yeah. So my name is Sean Kim. I'm a California Pharmacists Association staff. I'm a BP of Practice and Professional Development.
Fantastic. Great. So tell me a little bit about what that means. What are you guys doing in California?
So state associations tends to have pretty small teams, and so I wear different hats. And it entails to when somebody has questions about Board of Pharmacy, licensure issues, or compliances. Also, I go to legislative works as well, and go to talk to DHCS, which is our Department of Public Health Services, as well as Managed Care Services.
Okay, great. And I know you attended our healthcare executive roundtable yesterday, and we talked a little bit about we're up here in Washington, kind of the legislation they had passed about having pharmacists practice at the top of their license and the parity payment, all that. And it sounds like you guys have something similar in California.
Yeah, we learn from our neighborhood states, and Washington has been a great example. There are other states that are very championing practice of pharmacy, like Idaho, Iowa. So we learn from them. So some of our payment parity legislations are being able to work with commercial payers as well as the Medicaid MCOs too.
That's great. And what kind of services do pharmacists provide when they're doing those things?
Yeah, we kind of have to go back to a little bit of the history, which passed back in 2013 with the which is known as a provider status bill. And with that bill, we have a status of provider in pharmacy in California, allowing immunization, travel med, naloxone, hormonal contraceptions, HIV, PrEP, and PrEP. So those are defined pharmacy services that we can do as a medical billing services.
Okay, great. That makes sense. Yeah. So what else are you guys doing in California that's innovative and things that you've been working on?
Yeah, we are continuously trying our best to practice and meet our patients from the field. And recently, our Department of Public Health Services expanded the scope and the point of care testing. So that is also allowed to be reimbursed through a CPT code, as well as some other things that are on the horizon is some pharmacies work directly with the commercial payers and being able to do LAIs and more innovative services.
Okay, LAIs. I'm not familiar with that term.
Sorry about that. Long-acting injectables.
Okay.
So antipsychotics or HIV, PrEP, and PrEP.
Okay.
Yes.
Interesting. Very interesting. So how do you were also at APHA, I think, as a fellow. Is that correct?
That's correct.
Yeah. So tell us a little bit about that and the work that you did there as well.
Yeah. So at APHA, I think it was the biggest opportunity to learn about what federally happens, and but my specialty was geared towards to business development as well as education. So worked with corporate sponsors and coming up with the certification and certificate courses such as BPS and immunizations.
Okay, great. So, we're here at NCPDP, we're recognizing that, how important it is to have pharmacists do more clinical services. One of the barriers that we see is just kind of the ability to share data and get patient data, all of that. Just curious your thoughts about that, and are you working on anything there?
Yeah, I think data exchange is the vital piece of patient care because as a provider, we have to show the outcomes and ensuring there's the quality of the care. In order to do that, we have to be able to see the bigger picture as a provider
Yeah.
and being able to communicate with other providers and also transfer that information as needed to continuity of the care.
Yeah, that makes sense. So it sounds like you guys are doing quite a bit of work down there with some of the health plans. I know yesterday we talked a little bit about some of the barriers to that, some credentialing. I think we
Yeah.
heard one health plan say they get data from pharmacists, but, that it's not in the format they need, all of that. Sounds like you guys are also kind of dealing with some of the implementation things down there.
Definitely.
Just curious if you can just chat a little bit more about that and
Yeah.
efforts maybe going on.
I think it's also part of our professional identity as a pharmacy professionals.
Yeah.
Like, what is pharmacist? What is their responsibility?
Yeah.
What can they do? And we've been exploring more and more from different states and as a country together. But what we see is that patients need more healthcare providers and meet them at where they are. And pharmacists are uniquely positioned to that. But since we are doing that professional identity establishment, we also need to do the paradigm shift of what we have been doing as a pharmacist versus what is upcoming as an innovative model. So it's the internal and external changes that we need to implement, continuously educate our members, and also talk to the other stakeholders such as payers and vendors that who we work with.
Right.
So definitely there's some challenges because everyone does differently. It depends on the business to business, but we are figuring it out as a whole team.
Yeah, that's great. I know, and it's so difficult because we talked about, all right, each state is different in terms of what pharmacists can do, and their scope of practice, all of that. And I feel like you talked a little bit about kind of the education piece. I mean, to me, part of it's just educating, right? The health plans and the providers on truly what pharmacists can be doing today. So
Definitely.
yeah. So what are you as a pharmacist, kind of hopeful for? I mean, it seems like there's a lot of movement and interest, right, especially from health plans and providers to kind of continue to loop pharmacists into the patient care process. What are you hopeful for over the next couple years of what we can accomplish and what we can do?
If I have a magic wand,
Yeah.
I think this is the whole reason why I started pharmacy career, because pharmacy is where patient can go whenever they need to see somebody for help, readily available and affordable.
Yeah.
And we see a lot of health desert nowadays more than ever.
Right.
And
right.
How to bridge the gap of the health desert, I think pharmacy is the key. And in order to do that, we need to continuously develop not just pharmacists, but also work on the pharmacy technician side and defining what is possible. We are also doing work with like community health worker programs, and there are much more innovative ways to bridge the gap.
Yeah.
How we do it, I think we need to have everyone on the same table and discuss it as a team.
Yeah, definitely. I love the fact, I keep hearing the, pharmacists as community health workers. Would love for you to dive into that a little bit and just explain that to our audience.
Yeah, so moving on from the traditional model of pharmacy, pharmacy has built much trust in their community, and pharmacy technicians' role has also changed a lot too.
Yeah.
Some of the payers and also even state Medicaid program recognize pharmacy technicians to work as a community health workers or different names, and what part of their roles and responsibility is recommending nutrition as well as diabetes medication management, consultings like that, and helping pharmacists to navigate and provide more clinical services with them as a caregiver.
And it sounds like there's a certification for that, correct?
There is certificate programs.
Okay,
Yeah.
okay, and you guys are doing that in California then?
Yes, we do.
That's great, excellent. So just as we kind of wrap up, again, it was your first NCPDP meeting. Curious what you, what you've learned and what you think about all everything we're doing here.
Yeah, well, I cannot just thank enough Dr. Chan who brought me into this meeting. It's always meaningful to learn that we're other people that are working on the same topics and doing the work together rather than recreating the wheel. And I really appreciate NCPDP taking the in charge and building the standard of the framework of how everyone should work together rather than creating different topics over and over again. So
Yeah.
I'm very looking forward to get involved more and more in the future.
Great, that's fantastic. And yeah, as you know, we work closely with obviously APHA and the other associations as well. So, just kind of making sure that what the standards we're building and things like that will support what the pharmacists need. So, yeah, it was great to have you here, and hope to see you at another work group soon.
Yeah, thank you.
All right, thanks so much.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.